Welcome to the ChiroFit podcast, your number one podcast for all things fitness, injury rehab, and flexible nutrition. I'm your host, Dr. Yannick Schultz. I'm a chiropractor, a rehab specialist, and an online fitness coach. Now, the fitness world and everything online can become very loud and unclear. There's so much information out there. If you're over 30 and you're kind of asking yourself, how much should I be training? What kind of mobility work should I be doing? Should I be cutting out carbs? There's just so much information that gets watered down, and I'm here to basically make things a little bit more clear for you. This is our very first episode, and on this episode, I'm going to go through a little bit more about what I'm all about. So what I do as a chiropractor, what I do in terms of online coaching, and how I serve my clients in all different ways, and how this might be useful information for you. These are the things that have worked for me, the things that work for my clients, and hopefully you can take away something from this. I'm also going to deep dive into a little bit more about myself, my beginning, why I started all these things. So stick around. This is going to be fun. All right, so let's dial back a little bit, right? Let's talk about who I am. If you're just new to this podcast, you may have no clue who I am. So I'm going to tell you a little bit more about myself. I'm born and raised in North Bay, Ontario, which, if you have no idea where that is, it's a pretty irrelevant small town. But we grew up there playing all sorts of sports: hockey, snowboarding in the winter, tennis, soccer, all these things. And so I grew up playing a lot of sports. I had very athletic parents, so I've always had a good influence. And so sports and fitness were always something that were an important part of my life. I grew up idolizing and watching all of the Arnold Schwarzenegger movies, which really started getting me into the whole fitness aspect. My dad was always really fit and in great shape, so I had the aspiration to become the fit person as well. And truthfully, as a shorter individual who kind of had little man syndrome, I always wanted to get a bit bigger, right? This gave me the element of confidence that I wanted. It was also, in sports, when you're generally the smaller kid, it helps to be a little bit faster, stronger, more powerful. And so I got confidence from being able to do those things. And I do think that over the years, the more I've found love for fitness and different ways to build it into my life, it ultimately always comes back to giving me confidence, not necessarily just in terms of, vanity in the way that I look, but it just makes me feel good, gives me confidence. And when you look and feel your best, that's just the greatest expression of self. So for me, what really got me into chiropractic was my own injuries. So unfortunately, when I was 16, I blew out both of my shoulders. So separated both my AC joints. Those are the acromioclavicular joints. And so there was a long period of time where I couldn't even lift. I could barely raise my arms to the side. And this was a miserable experience. It took the life out of me. I could barely roll out of bed some days, let alone do the things that I wanted to, including sports. So I started to get therapy, started with physiotherapy at first to be able to kind of get through that. And that's what kind of sparked my love for getting into something related to the kind of health and fitness industry. So I learned over time how to rehab my injury, but I had needed help to get there first. So I learned that I wanted to do the same for other people. I wanted to be able to help others get back to the things that they wanted to do. And that's ultimately what kind of led me to chiropractic. In high school, I really started having that kind of foundation of kinesiology, which led me for a passion or love for human kinetics, for kinesiology, for understanding the human anatomy. And this is really what kind of was the catalyst for everything. And for the longest time, I actually thought I was going to go into physio, and I ended up going into chiropractic, and absolutely no regrets there. I think chiropractic's amazing. When people think of chiropractic, they often think of just rack 'em, crack 'em, right? Just go in 5 minutes in and out. And that's really not the style of chiropractic that I wanted to follow. I wanted to be able to bring all of the things that I loved, fitness and health and sport, into the treatment room and be able to bring that. So as I went through University of Ottawa, human kinetics, I got a more profound understanding of the human body, sports relations, training, all of these things, these principles. And then when I went into chiro school, which I went down into the States, I went to Palmer Chiropractic in Iowa, of all places. That's where I even got to deepen that understanding of things. And I did a lot of extra training, a lot of extracurricular certifications, things outside of school that allowed me to then, again, really understand the human body and bring that further and further into my own rehab journey. So at this point, even leading up to university, I still wasn't 100% able to do the things that I wanted to in terms of lifting. And it wasn't until I went into school and really had a better understanding of how all of this could help me and how these different training principles or rehabilitation styles could allow me to rehab my injury. And I played around with ways that I could then train and lift pain-free. And so that's a big part of what I do now, is helping other individuals, not only in the treatment room, but as well as with my online coaching, is help individuals understand how they can train pain-free and how that is possible. And especially as we get older, that is a big part of it, right? Is understanding, how can I do this without being in pain all the time? You've certainly been to the gym at a time where you had pain or you injured your shoulder and it either set you back or you've just been nagging and you've had to work around it or work through it for such a long time. And that can be very frustrating. I know that. I've been through it. Shoulders are just one of the many injuries that I've suffered. To its own consequence, I've had several different injuries, whether it's knee, a disc herniation, whether it's ankles, or something that is upper back related. You name it, I've probably experienced it. So in a sense, I have that extra element to be able to have an understanding of what people are going through, how to avoid it, how to prevent it, and how to train around it, more importantly. Health, fitness, these are big passions for me. And I want to make sure that everyone has access to this, because I think it is very, very important for all of us to be able to express ourselves in that sense. So for me, right now, once I transitioned from, chiro, I slowly started to bring in a little bit more training as I was figuring out that I could now help others beyond that capacity of just the treatment room. I absolutely love what I do in the treatment room, and it is nothing more rewarding than to help somebody who is in complete pain get back to the things that they wanted to do. But I also figured out that I could help people before they even get to that position. So not only with the online coaching am I able to get people to have better confidence, to get their six-pack back if that's what they want, or to get into a better healthy body weight. A lot of times it's just getting stronger, being able to live life. And that's the principle that I kind of live by with my coaching, is to be able to teach you how to do all of these elements, whether it's the nutritional components or it is the training components, and make it a flexible and sustainable approach around your life, around your schedule. Because ultimately, at the end of the day, most of us are not bodybuilders. It is not what we do for our life. We have our careers, we have our jobs, we have our families, other obligations, passions for fitness, but it's not necessarily everything that we do, right? So we got to make sure that we can include these things in our life. And so, it's building a system that allows you to do that pain-free. And we'll come back to kind of the nutritional component and how I approach flexible dieting. But I do want to kind of dive a little bit more into, what the chiropractic principles, allow us to understand. And so for me, a big part of the, again, ChiroFit podcast, right? Combining those two things, chiropractic and fitness. And for me, again, I don't necessarily see myself just as a chiropractor. I see myself as somebody who really looks at exercise and fitness and strengthening the rehab component and how that can really have a profound effect. Yes, the treatment is important. Getting you out of pain is the first part, right? We got to get you out of pain. But then the next phase is, how do we both prevent it, make sure that it doesn't come back, and get you in a spot where you can then get back into the things that you want to do. Because it's one thing to get out of pain, but it's another to perform at the level that you want to. So with these principles, it's understanding also that training can be part of your rehab. And that's what I've learned over the years. When we think of rehab, we think of these little banded exercises or things that, maybe don't always seem fun. And there has to be some degree of that at the base of things. There has to be a foundation. And depending where you're at, the level of athleticism, your experience, there may be levels to that, right? And this is, to me, is where the most important part of any clinician, a chiropractor, physio, whatever it might be, the most important element for them, for me, is the assessment. The assessment being the evaluation, the visual, watching somebody move, putting them through different positions and exercises to figure out exactly where their limitations are at and what the root cause is of the issue. Oftentimes, people don't do a diligent job, and this is not a shot at anyone, but we see it pretty often. We're not doing a diligent job. We're not doing an in-depth analysis to figure out exactly what the root cause is. Because it's one thing to say, okay, here's your pain, but it's another to know where it's truly coming from. And you may have experienced this where you have, let's say, shoulder pain, but is it truly coming from the shoulder, or what is causing it? It's one thing to say, okay, it hurts here and we're just going to kind of, work on all the muscles, or we're going to adjust it, or we're going to use machines or whatever it is. But if we don't fix why it's there, so as an example, if you have poor external rotation, you can't rotate back, right? That limiting factor is likely the reason you're having pain in the shoulder. I'm getting pain in the front of my shoulder right here. You know someone, or you have experienced that pain in the front of the shoulder. That didn't just appear out of nowhere. It appeared because of something, right? Whether that's posture, whether that is tightness of muscles, whether it's the lack of stability in a shoulder. That's a big thing when we look at it, right? Shoulder should be properly centrated in its joint, right? It should sit with good muscle balance. But over time, with other stresses, whether it's from repetitive strains or training or whatever we do, you think of something like tennis, where there's repetitive motions over and over. Those things over time can kind of lead to certain imbalances. And therefore, we generally will lose or lack something. And if you don't have the proper range of motion, that shoulder can't get into position. So for example, if I'm doing an overhead press and I don't have the proper external rotation, I'm going to chew or feed into the shoulder. I might not be able to get the shoulder blade into good position. I might overwork other areas. So you risk straining other things because you're not using it into its capacity. And the body is actually very smart in the sense that it will down-regulate contraction, meaning it's not actually going to let you contract your muscles to the fullest in an area where it feels unsafe or unstable. And if that's the case, you're not getting as much out of it. So the old, train through pain thing isn't always the no pain, no gain, right? That's not actually the best logic, because if you are training through pain, or if you're not addressing those mobility components, oftentimes it's just going to lead to something worse, or you're just not going to get the most out of those muscles. So when it comes to training and getting the most out of it, you want to make sure that you're addressing those things. And so a lot of people won't take the time to work on their mobility or work on the things that they need to, right? So for me, I use this as warm-up principles, but it applies to many, many things. It applies to just the general, fitness or rehab as well. And so we want to look at three main things. It can be broken down into more subcategories, but kind of the three main things that I look for is mobility, stability, and blood flow. So mobility being my ability, my capacity to move a joint, which is a little bit different than flexibility. You can get a joint into a position that's a little bit more flexibility. That can be passively, somebody kind of moving you into that position, or your body weight doing it. And then there's the active component, which is you moving yourself through it. But what is most important is that level of control. It's great that you can bring your arm all the way back here, but can you properly control it under load, under some sort of weight? If the answer is no, then again, this is something that we probably want to address. So I think it is very important that everyone work on mobility. Now, when people hear mobility, they think, okay, I've got to do all these little meticulous exercises to try and restore something. And that's not always the case. Mobility can also be brought on in training. It can be something functional. Technically, even, things like pressing movements or rowing movements, whatever it might be, even a squat can technically be mobility. When we use something, when we use weight, when we use resistance, we can think of that as a loaded stretch. So this actually benefits us to properly train in full length, full range of the motion, and utilizing, these principles that get us into kind of those deep rotations and stretches, right? So we're exposing ourselves. That also makes us more resilient. Anytime you can expose your body to things, it's going to increase your tolerance, your resilience, right? This is why athletes, athletic training is a lot of the exposure to the things that you're going to do in that athletic setting, which is also for me why I find certain rehab exercises, the little banded exercises, might be a great starting point, but is oftentimes not what you need in the long run. And that reason being, it doesn't always have a carryover into your exercise or into your sport. Right? How often are you doing this in your sport? Potentially, if you're reaching back in tennis, you're going here, maybe then to here. Potentially, right? You're swinging here, but oftentimes are we just pivoting here? The answer is probably no. And it's not to say that it's bad, but it's like, where is that carryover? Right? And it's understanding, having a better understanding of what you're trying to accomplish in that mobility or in that exercise. I'm going to use another example, and you've seen this at the gym. I know you have. Somebody takes dumbbells, 2 dumbbells like this, and they're doing this one, right? What somebody doesn't understand with that is what is that exercise working? You think, okay, I'm working external. And to some degree you are, but you also have to think of where the weight is taking you. The reason a band coming across works better is because that force is coming side to side. So when you externally rotate, I've got resistance coming this way. It's resisting my movement to the outside, which is what I'm trying to work is those external rotators, so stability muscles. When I have a dumbbell in both hands, gravity is taking that weight down. So technically, I'm training this up and down, not out side to side. Now, there's still going to be some effect on the shoulder, of course, but even just holding a weight has some effect on the shoulder. But coming out here, we need to understand what the purpose of that exercise is, right? What are we trying to accomplish? So intent becomes very important with mobility and strength training, right? You should have an understanding. You don't need to know the in-depth anatomy of what you're training, what you're working when it comes to rehab and all of these things, but you should have an understanding of just generally kind of what you're trying to accomplish. What muscle are you working? What position do you need to get that in? Right? What fibers might you be addressing? You don't have to know all this, and this is again why coaches exist, is so that we can help guide you through this so that you have a better understanding. But it definitely does help to know, what fibers I'm getting here versus in a lower position in terms of potentially the lat or the shoulder, whatever we might be addressing. So that first component is going to be mobility. And again, having a good mobility program means being efficient with your time, both in the gym and the exercises that you might need to do on the side at home. The second component is going to be stability, arguably one of the most important. And we could make the argument that stability would also give us more mobility. So the old saying is you can't fire a cannon out of a canoe, meaning a rocky base, you don't want to do that, right? The same applies to any joint in the body, as we generally want certain joints to be stable. We want mobility through those joints, but we want stability along with it. So when you see trigger points, and trigger points are basically that tight band of muscle that's generally a bit painful. It shortens the muscle, right? You've probably felt that trigger point in your pec, your glutes, sometimes the quads, the calves. That trigger point, so that ball of tension in that tissue, that's put there by your brain to try and create more safety or more tension around that joint. It's trying to protect you, but that's kind of a bad thing in a good way. So for example, a baseball pitcher who is trying to get back here, right? If the shoulder is unstable, if something is off, the body is going to put trigger points in that pec so that you can't fully lengthen and get back into that position. It's preventing you from getting into a position that it feels is unsafe or uncomfortable or it's uncertain of, right? So in this circumstance, stability becomes very important because if we can stabilize that joint, the body no longer needs those trigger points. So in times there are trigger points or tightness in a muscle, and we're trying to stretch them over and over. We're just trying to stretch them. You've likely done this. You've stretched a tight muscle over and over and over, and it does not go away. It stays tight the whole time, right? If you have a really tight muscle that just won't go away, the likelihood is it does not need to be stretched more. It likely needs some sort of stability or some safety so that it feels like it can let go of that tension. So again, stability becomes very important. So if I go back to my example of a shoulder joint, it should, in an ideal world, sit in its socket. But if we are decentrated, meaning not sitting in our proper position, we're going to lack that stability. This is where impingements in the shoulder happen because we're not sitting in the right position. We're often riding forward. That also becomes an unstable joint, meaning it's not very strong. We're not using the little stabilizer muscles. And this is, again, why these things become important, because if you're just lifting the heavy weights all the time, you're not always addressing those. Now, it's not to say that if you're lifting weights, you can't address some of those the components, but ideally we still want to work on those things, especially if we're noticing things. You may not have as many dysfunctions at this time, but in an assessment, again, like we talked about at the start, this is where we need to identify, are there limiting factors? Is there lack of range of motion? Does the joint not move as well? Is it not as stable, right? And when we can identify that, then we can give you the right tool for the right job, which might be more stability first, which might be more mobility, or again, this blood flow principle. So stability can oftentimes be through weights. It could be banded exercises. I find bands can be a great way to implement an external stability, but you don't necessarily even need bands. Sometimes it's just positioning the joint and adding some form of resistance, which could be your body weight, which could be holding an isometric position, so holding without moving. There are many, many ways that we can work on stability. When we think of the foot and ankle, for example, if you stand on your foot in a single leg balance, can you properly sit or stay on your foot without rocking back and forth, without losing your balance? And if the answer is no, then okay, we probably need to work on the intrinsic muscles of the foot, the little muscles that help stabilize that foot so that it can properly support you. And if we're doing a good job, we're also going to analyze and look at the hip. Is the hip doing its part? Because the hip and foot move together. So again, these are a little bit more nuanced concepts, but with that, it's having the understanding of where do we need to identify that. And so when I put together a warm-up protocol, when I put together a program for myself or for clients, I'm again looking at mobility, stability, and now blood flow. Blood flow being very important because, again, tissues that are avascular, meaning they're not getting as much blood flow, or tissues that are just not getting just as much blood in general, are also going to bring in more trigger points, meaning they're going to become tighter. And we want blood flow not only to warm up the joints, but it's also going to help flush out the tissues, bring out whether it's inflammation or lymphatics. We want to kind of flush that tissue. And even more so in a warm up, this is where blood flow is very important, right? If you look at any professional athlete, they are taking the time to really warm up. You won't find many professional athletes who, before the game, on the side of the field, in the prep room, wherever it is, that they're not doing some form of warm-up prior to the event. And we don't treat ourselves as, weekend warriors or people who are training on the side. We don't treat ourselves enough like athletes, and I think that we should, because a lot of us will go out for a run, we'll join a fitness class, we'll jump into a sport, tennis, hockey, whatever it might be, and how many times do you truly warm up before that? You might do the odd little stretches, some leg swings, things like that, but how often are you doing that? And I encounter this a lot in my clinical practice with clients, patients, where, they're runners. This is a great example. Runners are probably the prime example. You go out for a run, you wake up in the morning, you do a couple little things, you get your shoes on, you go out the door, right? And you didn't really warm up. And then you encounter a rolled ankle, an injury, something, right? You didn't prep. I think warm up or blood flow to me is that preparation. It's prepping the tissue, which I think also to me falls into that bonus category, which would be priming the nervous system. I think all of these things can help prime the nervous system. Blood flow to me falls into that one. I'm warming the body up, I'm priming the nervous system, I'm getting it ready for what is about to happen. This is, again, where I want to probably look at mobility, stability, and blood flow in my warm-up, have a few things that are going to address all of those components so that, again, my body is ready to encounter whatever it is that increases my tolerance to that activity. If I go out there cold, I'm increasing the risk of an injury. Now, injuries could happen regardless. You could roll off a curb, something could happen, you could get hit by a car. But the more we are prepared, the less likely it is that these things are going to happen. So I think these preparation concepts are very, very important. So I think this can kind of lead into a good point of the biggest mistakes I see that people are making when it comes to their training or potentially their rehab. And I'm going to talk more on the training concept because, again, if we're doing a lot of these things, you're probably not going to need as much rehab. If you're already injured, then you might. But obviously, the point of all this is to try and prevent injuries from occurring. The one thing I would say that I see is that people are, and we kind of touched on it, is that people are training through pain, right? Pain is a signal. It's not necessarily a signal that something is damaged, but it is a signal for you to take action. Your body, it's like a check engine light in the car. Maybe something's wrong, but it might also be warning you that, okay, you need to go get this checked. You need to bring it in. So when you're training through pain, you're just basically shutting off. You're hitting the snooze alarm and you're shutting off that signal that your body is telling you something is wrong and I need you to address it or something's going to get worse. So as you keep training through that, the likelihood that you do get injured increases because you're just ignoring that. Now, there's a distinction between actual pain and general soreness and tightness, but I'm talking kind of true pain. Again, if we take that example of shoulder pain right in here and you're just kind of grinding through it, eventually it's going to lead to something else. And most of the time when people come to see me in clinic, it's, oh yeah, I did this 2 or 3 months ago and I wish I came in sooner, right? We don't address it soon enough. Now that could be you addressing this on your own, but if you're not 100% sure how to, this is where finding a good clinician or your coach or whoever it might be that can help identify these issues early and help work around them. Or we prevent them in the first place, again, following some of these principles. The other thing that I'm seeing is kind of these random workouts or the desire to always switch things up. There is a reason that we should be doing workouts for a consistent period of time. To me, it's like 8 to 12 weeks is a good minimum, probably more than that. 8 to 12 weeks of a program. People want to switch to nuances, the quick new workouts, the fun thing. Let me try all these things. You want to get good at your base, right? This allows you to then not only get stronger in those exercises, perfect the form, perfect the movement, make sure that you have good position, good stability. But if you're always changing it up, your body doesn't really know how to adapt to that. And so it's never going to improve. Picture the basketball player, right? When you look at them, they have a shooting stroke that is almost always the same thing, right? It's always the same rhythm, the same stroke. They've worked on that for 10,000 hours or more. They've shot how many shots? You think of Steph Curry. I'm a LeBron James fan, but we're going to talk about Steph Curry for a second. One of the best shooters in the world, probably the best shooter ever. He can do it with his eyes closed. He can hit, I don't know how many shots in a row. Like his record is, 80, 100, something like that, where he's hit it in a row because he's perfected that stream all the way down. What if a basketball player shot a different way every single time? A little bit off this way, a little bit this way, changing it every time, which is what most amateurs are doing and why our shot is never going in over and over and over, because we don't perfect that form, we don't perfect that repetition. The same thing applies to the gym. How do you expect to get better at a singular thing, get stronger, develop more muscle when you abandon ship on it so quickly? You're just randomly doing things every time. And I get it. Gyms get busy. And so you can't always do things in the order and the way that you would want to. And it's okay to modify once in a while, especially if you've been doing it for some time. I don't always do the exact same things, but I try and kind of mimic the same movement in a different way. Whether it is, like a dumbbell press or doing that on a, incline Smith machine. Maybe I'm doing that in a bench press. There are different variations that are still ultimately trying to target or achieve the same thing. That's still a similar repetitive pattern. But this is why doing the same program, and I've probably done the same program for 6+ months before really switching things, because I want to not get bored with the basics, right? And I want to make sure that I'm really perfecting my form Same as that shot. I want to get really good. I want to be the Steph Curry of the gym world, right? Is being able to repeat and do that same thing over and over till I am so good at it that your body has no choice but to maximize and utilize everything in that circumstance. So the other side of that coin, right, is that sometimes in the training world, we're doing things in different priorities, right? What is it that you're trying to achieve? A lot of people will focus way too much on the cardiovascular aspect or not enough. And I think that cardio has a really important place, but strength training should always kind of be the fundamental base of what we're doing. Ultimately, that is going to yield better results in terms of your physical development, the look that you want, and also strength is going to generally lead to more resilience, which again is going to help you prevent injuries in the long run. So it's great to run and to do, to be the cardio bunny, but that doesn't really help you in terms of an athletic performance stance or an injury prevention stance. Some people might look down on working out. Well, I don't need to work out. Why should I do that? To me, working out has a direct it's not just a vanity thing. It's great to look good, but working out has a direct crossover to all facets of life. Picture having to help your friend move. Whether you're over 30, you're 80, even if you're a bit younger, you're helping your friend move. You have to pick up furniture, pick up a couch, or the groceries that you bring in, the suitcase that you have to lift and put over your head on the plane, whatever it might be, right? These are all examples of things that we might have to do. Pick up the vacuum, whatever it might be that you have to do. When you are stronger and more resilient, these little things have such a less impact on you. The amount of times that somebody comes in and they're like, oh, I just bent over to grab the vacuum, or I was carrying in groceries and I injured myself. A lot of times it's because we're not training to create that resiliency. So those things actually take us over that tolerance and we end up getting injuries. Now, flukes happen. Yes. But at the end of the day, when you are more resilient, you are less likely to get injured. And this is where training comes into. Think of training as the things that just make you better at all things in life. You want to be able to carry groceries into the house, up the stairs, right? Do that hero run of grabbing as many as you can. And you can start to train in a way that includes those things, right? An example would be farmer carries, right? Walking with weights in your hands. That trains not only the core, the hips, the shoulders, the back. It's prepping you for an actual movement of lifting things. When we think of deadlifts, when we think of rows, those are things that could be transferred into picking up a couch, a chair, heavier objects, right? If you're somebody who does painting or work overhead, right? Training into these movements, whether it's pulling movements that bring me into this lengthened position, whether it's doing shoulder press or lateral raises, it helps, again, increase that tolerance and exposes you to things that when you are now into those positions on a day-to-day, you are more resilient for it. So I think it is very important to look at training as a beneficial thing for life. And the older we get, it becomes even more crucial. We tend to lose muscle mass, right? We become a little bit more osteoporotic or a little bit weaker as we age. These things can help prevent that as well. We see that in the female population, especially as we're aging. Osteoporosis is a really big thing. That means our bone density decreases. We know that the number one thing outside of nutrition for that is going to be resistance training of some capacity. And that doesn't always mean that you have to be in there deadlifting 500 pounds to become more resilient. That can be whatever version of that is for you. But I would argue that walking on the treadmill is probably not going to make you more resilient or really, really strengthen your bones the way that we need them to. So I think at all ages, it is increasingly more important. You want to prevent slips, falls, any of these things, right? You work on balance, you work on stability. These are all things that you would inevitably get in the gym, especially if you're doing a little bit more than a bro split, right? You're doing some functional training, you're doing some one-arm movements, single leg movements, some things that bring you off balance, like a single leg RDL, things where you're one arm overhead, things that may involve the core, whether that's like med ball tosses or slams. It's functional, it's part of life, right? And eventually then we can get into the idea of training for your sport, right? If you're a tennis player, if you're a hockey player, whatever it might be, soccer player, you have rotational components. Running is the one where you're a little more straight line. But other sports have lateral movements, lateral bounds, have rotational movements. And so if we're not including those things, then we can see how when we do those things, how we're exposing ourselves to something we're just not ready for. It's not the load that breaks us down. It's the load we're unprepared for. Keep that one in mind. Now, outside of training, the one thing that I preach a lot is nutrition. So to me, nutrition is something that is grossly overlooked. We're not taking enough time to address that. Or, when we're looking at the population, we have an increasing epidemic of obesity, of people who are overweight. Generally, those who are more overweight, undertrained, are more susceptible to injuries. When you don't have a great metabolic state, that's not just your metabolism of weight loss, but just your general metabolic state, we see more injuries. Joints generally degenerate more, not because of wear and tear. So when you hear arthritis or degenerative disc disease or degenerative joint disease or whatever it might be, a lot of times that's actually due more to our holistic approach, our nutritional components, right? And is what we're putting into our body. You're more inflammatory when you are more overweight. Your body is more at risk when you're not taking care of yourself. So that does include the training, but it also really includes the nutritional component. And so when I look at nutrition, I'm looking at a couple principles that are going to help me on this, right? And so flexible nutrition is important to me because I think it is very important to be able to blend it into your life and blend it into your lifestyle. So when it comes to weight loss specifically, or fat loss, whatever we want to call it, we want to generally be in a caloric deficit. And that can be a bit challenging, especially when you don't enjoy it or you're miserable doing it. And I think that fad diets, whatever it might be, whether it's keto, whether it's carnivore, low carb, paleo, whatever it might be, they're not always sustainable. For some, potentially, but I don't think they're sustainable in the long run. People generally like something like keto because it tends to be quick weight loss. And if we want to look at why that is, one of the main reasons is you're eliminating one main source of macronutrients. Macronutrients being your proteins, carbs, and fats. When you're on keto, you're not eating carbs. Therefore, you are taking away one of those. And it is a lot easier to, when you eliminate carbs, because they generally tend to be the things that we go towards that are maybe a little less healthy, so to speak. But it doesn't mean that we can't include them. And to me, I want to include those things. I like bread. I like carb. I want to be able to include those things into my diet, but I want to find the sustainable approach to do so. And to me, that's why diets never work. These strict meal plans, these restrictive eating, all these things don't typically work very well because they are so restrictive and they don't fit your lifestyle. They don't allow you to go out. They don't allow you to do things with friends. You're not getting the most out of it. And you're going to fall off because you dislike it. If you love keto, great, do it. And if you feel like you could do it forever, great, do it. But for most people, these types of diets, these more extreme diets, are less sustainable in the long run. And so to me, it's good to have that moderation in that blend. And that does, for me, include having sweets and having things that I enjoy. But again, at a level of moderation. The old 80-20 split or 90-10 split to me is important. I've done the opposite. I've done the restrictive dieting. I've done the over-the-top, nothing fun, no alcohol, less carbs, all these things. And in the end, it did not yield a better result than having that flexibility because, again, you're either going to binge when you do get those things, right? People lose a lot of weight on keto, again, because there's no carbs. There's no real water retention. Carbs tend to hold a little more water, so you lose weight fast. But are you truly doing more in terms of fat loss? Probably not. Ultimately, like I mentioned at the start with the food, when we want to lose fat or lose weight, we have to be in a caloric deficit. All of these diets, when you look at them, put you in a caloric deficit no matter what. Keto, you're taking away carbs, so you have one less food to eat. Fasting, you're taking away your window of time in which you eat. So again, putting you likely in a caloric deficit. You could technically overeat on all of these diets and whether you're eating keto or not, if you eat too many calories, you are still going to gain weight. And it doesn't matter that you're not eating carbs, right? It might be a bit harder because it's generally you're eating more fats and protein. So it's harder because you're more full, you're satiated. You don't necessarily want to eat those things, right? And the things that we fall on is the things that, make us feel good, give us dopamine, that, the chips, the ice cream, the bread, all those things. And they're easy to eat and consume a lot of them. So we overeat in our calories. So for me, I still want to include those things. I just need to do them in moderation where I can have enough of them, but not necessarily go overboard. So to me, one of the most important things that people can learn is tracking your calories. Tracking your calories to me is the easiest and most fundamental thing you can do. And people are going to say, well, I don't want to do that. It's annoying. Well, do you want to make a change or not is the final kind of answer there. And if you're not tracking, you're just estimating, you're guessing. And for some people that works, you can get away with it. But when you truly want to make a change, that is the easiest way. So the suggestion with this is that when you track your calories, think of it as a budget. If you wanted to go on a trip and you were going to budget for that trip, right? You're going to figure out what your income is, what your output is, have an understanding of what's coming in and out so that you know where you're saving or where you need to cut certain things out or what you're allowed to have. Calorie tracking is no different. It's giving you control. People think of it as restrictive. Oh, I don't want to track because it limits me and I have to. It should give you more flexibility. The way I see it is it allows me to figure out all the things that I can have in my diet, not all the things that I can't have, and still make progress. So for me, I'm eating things like Oreos, we just had Easter. I'm having Easter chocolates. I'm including these things. I'm going out for dinner. The odd time I'm having, a drink. Things like this that would still allow me to have some freedom and flexibility. Now, with tracking or with any of these flexible approaches, we can't just eat, we can't just go to Costco and eat pizza and, the ice cream and the chips and all these things and just assume that we're now going to lose weight. You technically could if you're tracking your calories properly, but it doesn't mean we just get to eat anything and everything. It just means we get to have them in moderation. And we still have to prioritize the things that are important. Our carbs, our protein, our fats, our vegetables, and eating within a calorie budget. So when you're thinking of tracking, think of it more as a budget. Same way you would budget for a trip. It's important. You want to go to Greece, let's say, right? How do you budget for that? How do you know what's coming in and what's coming out? Calories are exactly the same. How much is coming in? How much is coming out? So when it comes to fat loss, weight loss, there's really only two things that we can do. We can decrease our input, the amount of food that we're eating, or we can increase our output, the amount of activity that we're doing. Now that could be steps, that could be walking, that could be cardio, that could be doing classes, strength training. And then the other side of it is the nutrition. And there's a fun, healthy balance between that where we can figure out, for me, and I say this to a lot of my clients, is I want to figure out what is the highest amount of calories that I can eat, the largest amount of food I can eat while still losing weight. Because ultimately, I still want to look at building muscle, performance, my overall health, right? If I'm way too depleted, if I'm eating way under calories, some people will eat far too little and don't lose weight. And then they're saying, well, what's going on? I see this time and time again, especially with female clients, under eating and then wondering why they're not losing weight. Well, you're not giving your body what it needs. At the end of the day, it's still fueling your body appropriately. So it's not always under eating calories. I had a client that when he came to me, he was eating around 16 or 1700 calories. And I actually bumped him up to about 23 or 2400 calories. And we started to see change. He was stuck at that lower point. Nothing was working. We brought him up, gave him what his body needed, and he started to lose weight, to get leaner, and he felt way better in his workouts. And so had he just followed the principles of I need to eat less, he would have continued in that cycle. But we were able to fix that. And then we actually slowly, as we got him leaner, we were then able to give him back more food, more energy. And he was able to use that. And then he got to a point where he was eating about 3,200 calories and still staying relatively lean. And so again, we're playing with metabolism, we're playing with how your body adapts to things. And so when you have a better understanding of that and you know your calories, you know your budget, you can start to play around with those numbers a little bit and you can have fun with it. But the important goal to me is being flexible, having an approach to nutrition that you can follow over time, that you can sustain for a long period of time. You want to say, I could do this forever. And there might be times that you need to sacrifice a little bit more, that you need to give things up a little bit. Again, moderation. If your goal is bigger, you may have to make more sacrifices. If you have more to lose, you may have to make more sacrifices than somebody who has a little bit less work to do. But at the end of the day, we still have to make some sacrifices. It's just finding where that balance is and still being able to enjoy the things that you want. So this kind of wraps up some of my main principles. We discussed, a little bit about myself, where my background comes from, how I got into this, what I enjoy. We talked about the main training principles, rehab, and including the things in training that are going to benefit us in the long run: mobility, stability, blood flow, or priming the nervous system in that case. Talked a little bit about why it is important to train and why I believe it is important for everyone to have some version of resistance training and physical activity. And we talked about nutrition and how that component can really have a profound effect on not only weight loss, but everything in terms of our joints, our health, all those. So in future episodes, that's exactly what we're going to go through, is we're going to dive deeper into these principles. We're going to break some of these down a little bit more. This is an overview and a glance of the things that we are going to discuss, but I look forward to being able to dive into these nitty-gritty topics and to deep dive a little bit more into the components of mobility, injury prevention, strength training, nutrition. Because as the ChiroFit podcast, again, this is your number one place to find information on fitness, injury rehab, and flexible nutrition. Thanks for tuning in. We'll see you on the next episode.